Hello and welcome. This is Medicare 101. In this presentation, we are going to talk about how Medicare works overall. And then with that, it may give you some idea as far as what your next steps are with Medicare. We're going to cover the four parts of Medicare. We're going to talk about what it does not cover, how there's more or less two options to protect yourself when you come onto Medicare. One of those is Medicare Supplement. The other is a Medicare Advantage plan. We're going to talk about what is a Medicare supplement plan and how we compare those. What is a Medicare Advantage plan and how could you compare those? And then also Part D, prescription drug plans. And then we'll talk about important enrollment dates, certain deadlines, costs for 2023, and probably a little more. Again, to introduce myself, my name is Jason Gray. Originally, I am from Batavia, Ohio. Still reside there as of now. Right now, I'm trained and associated with some different managing partners. They have about 50 years of experience between them, and currently I'm licensed in about 17 states, Ohio being my home state. I help clients all over the country with this, but we do also have a local office here in the state of Ohio in Bethel, which is about 25 miles east of Cincinnati. I am an independent broker, which means I do not work for any specific insurance carrier, specific company. My job is to help educate you on what your options are as you're coming on to Medicare for the first time, or if maybe you're already on Medicare, that might be you, and then help you find a plan or a company that will work best for your situation. If you have Medicaid, much of what we talk about in this particular presentation may not apply to you. You're still welcome to review. You may be someone that has Medicaid now, but that may change into the future. But if you do have Medicaid, there are specific plans designed that will work directly with Medicare and Medicaid. They help combine those benefits together, and many times will offer additional over and above what you would typically receive from just Medicare and Medicaid. So you can call me directly or shoot me an email if you have questions on that. My contact information is at the end of this presentation. If you are still working, have employer coverage, maybe you're covered by a spouse's employer coverage, you need to confirm whether or not that employer still will cover you beyond the age of 65. If it's considered qualified coverage, so your human resources department should be able to provide you that information, or the broker that manages the insurance for your company should be able to provide that for you of whether or not it's considered qualified coverage. Okay. If it is, you do have the ability to compare your costs with that coverage to what is available with Medicare. So it gives you a little bit of additional freedom. You're not forced to do anything, but you get the ability to compare and choose. Many times you'll find that Medicare is often a better option. However, sometimes because of costs and who may be covered, it may be better to stick with your employer coverage and delay your Medicare for the time being. The four parts of Medicare. Part A, if we think of an ambulance takes us to a hospital, that would be our hospital insurance. We have Medicare Part B, so our medical insurance, that would be like doctors, specialist visits, outpatient type care, different things of that sort. Part C of Medicare, that's going to be Medicare Advantage plans, like HMOs or PPOs. You may have heard some of these terms before. This will include Part A and B, and sometimes will also include a Part D prescription drug coverage, which then brings us to the fourth part of Medicare, which is your Part D prescription drug coverage. Original Medicare, Part A, we're going to go over the hospital coverage now. You become eligible for this at the age of 65. There is no cost for Part A as long as you have worked 10 years or more, 40 quarters or more, and paid into Medicare. This will work with any hospital that accepts Medicare nationwide. Your Medicare benefits will restart after you are out of the hospital for 60 consecutive days. There are deductibles and co-insurance for Part A. The deductibles reset after 60-day periods. So days 1 through 60, you have a $1,600 deductible for 2023. For example, if you were to go into the hospital, your deductible would be $1,600. If 65 days later after being discharged, you happen to go back in, you would most likely be subject to another $1,600 deductible on Part A of Medicare. If for some reason you were to have an extended stay in the hospital and you were to stay completely days 1 through 60, you would also then at day 61 be subject to an inpatient hospital stay of $400 per day up to day 90. If your stay would continue, at day 91, you start to get into your 60 lifetime reserve days, and you are now subject to an $800 per day co-payment for your hospital stay. There's a $200 per day co-payment at a skilled nursing facility. So for instance, if you were to go into the hospital for the full 90 days and stay past that and get into your 60 lifetime reserve days, if you were to be in the hospital for a total of 150 days consecutively, you could be responsible for $61,600 for that one-time stay. Once you have gotten into your reserve days, they are not available ever again. So if you were to have a second extended stay in the future, those lifetime reserve days of that $800 copayment are now gone, and you're responsible for the out-of-pocket expense of that hospital stay. Now we're going to talk about Original Medicare Part B. Again, this is your medical coverage. Again, you become eligible at age 65. However, you can delay if you're going to continue working or you're covered under qualified insurance. The premium this year is $164.90 per month, so roughly $165 per month. If you have a higher income, you're a higher income earner, you may be subject to additional costs. This is again going to work at any doctor or facility that accepts Medicare nationwide. There is an annual deductible, so not every 60 days, but annually with Part B. This year is $226, and you're responsible for a 20% coinsurance. Medicare will pay 80%, you are responsible for 20%. In the event, if you were to see a doctor facility that does not accept Medicare assignment, you could be subject to a 15% excess charge. However, those are not very common. And again, your maximum out of pocket, there's no cap. So you are subject to no limit with just Original Medicare. So now that we understand some of the coverages and the shortfalls if we have only Original Medicare, now we need to look at how do we want our coverage. Option one is we can stick with Original Medicare. We have our Parts A and B, or hospital and medical insurance. Then we determine whether or not we would like a Medicare supplement or a Medigap policy. And then you also need to determine if you have what is considered qualified prescription drug coverage. If not, you'll need to add a Part D prescription drug plan to make sure that you stay in compliance and are not subject to any type of late enrollment penalties with Medicare. Okay. The other option we can go with is option two, a Medicare Advantage plan, which is Part C. Again, it's going to combine Parts A and B of Medicare, and then typically also include Part D of prescription drug plan. If you fall into a category that you already have qualified prescription drug coverage, there are plans available that do not have that component added, which may give you some additional benefits over and above just the typical Medicare Advantage plan that includes that drug coverage. So now we're going to talk about Medicare supplements and what they are. Again, you have to have Parts A and B of Medicare. You will pay a monthly premium for your Medigap policy in addition to your Part B premium of Medicare. These cannot include prescription drug coverage, and the cost will vary by company, and the policies will go up as you get older. The great things about supplements is that the coverage is guaranteed at age 65 or when you first come onto Medicare. Your choice of doctors and hospitals is nationwide, anyone that accepts Medicare. Coverage is standardized. So, what that means is when we look at a Plan G from one company, your coverage is the same as a Plan G from another company. So, we truly are comparing apples to apples. This chart here, like most of this, comes directly out of your Medicare and You handbook. We tend to look at Plans G and Plan N when we talk about a Medicare supplement. With a Plan G, you are responsible for your Part B deductible for 2023 of $226. After you have paid that, your supplement will come in and take care of the 20% that you would have been subject to, as well as additional co-payments and co-insurances that you had on your Part A of Medicare. Plan N is very similar to Plan G. However, you may be subject to a co-payment of up to $20 for some office visits and up to a $50 co-payment for an emergency room visit that does not result in an inpatient admission. Plan N, you may also be subject to those excess charges of 15% if a provider does not accept Medicare. However, again, those are rare, and in some states, Ohio is one of them, they're actually illegal to charge at this time. Again, the way that we compare a Medicare supplement, it's truly an apples to apples comparison. It's just a matter of who the company is and what the price of that plan is with that company. When we look at Medicare supplements, they will increase annually. This chart here gives you some examples. Plan F is one that is no longer available, but you can see it has a pretty high rate increase. We can't predict the future, but the more that those costs are spread, we can assume that they will increase at a slower rate than another plan. So Plan G right now is probably the most common, but we will see most likely a higher rate increase with a Plan G versus going the route of a Plan N. So that is something that you need to take into consideration depending on your health. When we get into Part D, your prescription drug coverage, these prescription drug plans, they will have a monthly premium and a deductible. Those benefits from these plans are going to work off the calendar year, so January 1st through December 31st. Plans also use a formulary. So this is kind of a list of drugs that are covered by the plan. Every company treats their formularies differently. So one prescription drug may be covered differently on one plan than it is on another. Most plans are going to separate drugs into different tiers on their formulary. Tiers 1, 2, 3, 4, etc. Each one has a different copay or co-insurance associated with it. Some of your prescription drugs, they may require a prior authorization, or there may be quantity limits as far as how much can be filled within a time frame. And then you may also be subject to what they call step therapy. So you may be required to try a similar or a lower cost drug before the plan will come in and cover the cost of maybe a brand name or a higher dollar prescription drug. How do we compare prescription drug plans? Well, we look at the total annual cost. We cannot just look at a monthly premium because each plan is unique. We can't look at just deductibles either. Okay. We have to look at your specific medications in pharmacy and how those are covered. So we look at the total of your monthly premium plus copays and coinsurances, and any deductibles, and we calculate all that together to look at a total annual cost for your prescription drugs. So, how do we compare Medicare Advantage plans? Well, these are not standardized. They have different doctor networks, different drug formularies because your Part D is built in. However, Medicare still separates your costs between your prescription drugs and your medical care. You're going to have different copayments and out of pocket limits. These plans can also change every year. Many times, Medicare Advantage plans will also include different ancillary products such as dental, vision, and hearing coverage, which were not included with a Medicare supplement. And many times, these plans have no additional premium to your Part B of Medicare. Talk about important enrollment dates with your Medicare supplement. You can lock in your coverage up to 6 months prior to your Part B effective date. You do also have 6 months after your effective date to choose a carrier. However, once you get outside of this window, you may be subject to health questions to be able to qualify for that Medicare supplement. Again, the first time you come onto Medicare, whether that's at age 65 or after losing qualified coverage, like retiring, there are no health questions for you to qualify for a Medicare supplement. After you are outside of this open enrollment period, you may be subject to health questions to be able to qualify. Enrollment dates for Medicare Advantage plans and Part D. These follow the same timeline. You have 3 months prior to your Part B effective date to be able to lock in your coverage so it's ready to go once your Part B effective date starts. You have the month of your birth month, and then 3 months beyond that. If you're already receiving Social Security benefits before you turn 65, your enrollment is typically automatic, and you'll receive your original Medicare card, that red, white, and blue card, in the mail about 3 to 5 months before your birthday. There's annual enrollment dates, AEP. You may have heard of this before. This is many times when commercials will pick up on TV. October 1st of every year is when you can review your coverage for the following year. You can then enroll in those plans starting October 15th for effective dates January 1 of the following year. And you need to get all that done prior to December 7th. During this time, you can add or drop a Medicare Advantage plan, a Medicare Advantage with prescription drug, or prescription drug plans, and return back to original Medicare if you'd like. There are a couple different ways that you can enroll in a Medicare plan. One, you get to do that on your own directly with an insurance carrier, compare everything on your own between the different companies, and hopefully find the right coverage for your prescription drugs and your medical care. The other side is you get to utilize a independent insurance agent. We get to compare all of those major carriers for you and really narrow down to your specific situation. We get to look at rate trends with those companies, help you with the application. We can help you annually shop those rates with a supplement plan or just looking at those coverages in regard to a Medicare Advantage plan and if there's been any changes to those plans themselves. And then also any upcoming changes that are going along with Medicare, you can always bounce those questions off of us. Things that you get in working with myself, I'm going to give you again a non biased opinion looking at all of those major carriers. It really doesn't matter to me which one versus another. It's a matter of finding the proper coverage for your individual situation. I'm your direct advisor on the ground. Even though I'm on the phone, essentially, I'm your local agent. We get to again help review that coverage every single year, and there is no cost for my help. The way I get paid is directly from the insurance carrier. Here's my contact information for one last time. Again, 513-855-6524. That's my direct line, or my email, jason.gray@moderninsurancestore.com. You can also check out our website, moderninsurancestore.com. You can see some other helpful videos on there as well. When we talk about next steps, If you are within 3 to 6 months of coming onto Medicare for the first time or within your birth month, we should set a time to talk to narrow down your specific situation. It might be time for you to come on to Medicare, or it may be time to delay until you retire or you're coming off of a spouse's coverage. We'll schedule a time, talk about your situation, and help develop a game plan as you get closer to Medicare to make this process and change as smooth as possible. Thanks again. Take care.